My name is Hannah Hetzer. I am the Senior International Policy Manager at the Drug Policy Alliance in New York. And I want to thank McGill for hosting this important discussion, for being a part of the debate, and for inviting me here. In listening to that previous panel, part of me thought, should I reorganize my entire presentation and try to defend regulation? But I'm not going to do that because regulation is coming to Canada. So I do want to talk about some of the things, some of the good that we can hope for, some of the lessons learned, and some of the things that we should look out for. So I'm going to talk about marijuana and harm reduction, and I'll start by talking about that in the more classic sense of the term, but I also want to talk about marijuana regulation as a means to reduce the harms from punitive policies. There's an increasing number of people, especially in Latin America, that are referring to harm reduction, not just in terms of minimizing the risks associated with drug use, but also in terms of reducing the harms created by bad policies. So I'm going to share a few of the lessons learned from the US states that have started legalizing and regulating marijuana in the previous years. So just a little landscape. We have almost 30 states with legal access to medical marijuana. We have, medical marijuana. We have 9 states plus the District of Columbia with legal access for adult use. This started in 2012 with Colorado and Washington. States have joined every other year since, and this year Vermont was the first state to do it through the legislature. The others were ballot initiatives. And Uruguay in 2013 became the first country in the world to do so. And I'm excited for Canada to be joining these jurisdictions and bringing its own model, and maybe it's multiple models since it's deferring some of the decision-making power to localities. Regulation does provide some tools for control, and I think if the government's not providing that, that's where our push should really be, not abdicating total responsibility to a prohibitionist system where the only decisions, aside from law enforcement decisions, that we can make are abdicated to the illicit market. And if you don't like advertising, we in the United States, we couldn't follow Uruguay's model of banning all indirect and direct advertising because of our commercial free speech laws. I don't know if Canada could do either, but I think those are the areas where we really need to push our governments to use the regulatory tools available to us to shape the market and the industry and the environment to look like how we want it to look. So I'm going to first start about talking about marijuana and opioids. The US is going through a current overdose crisis similar to Canada. We have 175 deaths a day due to overdoses. It's the leading cause of death under 50. And it's a tragedy at an enormous scale. But there is an emerging body of research that is showing a correlation between access to legal marijuana and reduced rates of opioid-related harms, mortality, and dependence. These are just some of the studies, and I think some of it is cut off, but these are some of the studies that have been done in recent years relating to this, that have shown that in states with legal access to marijuana, rates of opioid overdose are 25% lower than states without legal access to marijuana. And in states with access to medical marijuana, it is associated with a 23% decrease in opioid dependence or hospitalizations. In Colorado, what we saw was post-legalization, it was on an upward trend, and then it started on a downward trend post-legalization with 0.7 fewer deaths a month post-legalization. And the theory here is that marijuana has been shown to be helpful treatment for chronic pain, and there may be a substitution effect where some people are substituting away from opioids and towards marijuana. There's also some research happening in Latin America with their versions of crack, so Pastabasa in Uruguay and Bazuco in Brazil and Colombia, some research being shown on them being an effective substitution for their version of crack. And it's too early to say that this is indicative. it is a correlation, not yet causality, but it's something that we really need to continue studying because it's promising. And our new medical marijuana reform advocate, Sanjay Gupta, who is the CNN chief medical correspondent and was Obama's pick for US Surgeon General, just 2 days ago, he released this open letter to Jeff Sessions saying medical marijuana could save many addicted to opioids. And in this article, which is available at CNN, you might get distracted by the Sean Hannity is a welfare queen article, which I did. He talked about some of this research that I've talked about. He talked about marijuana's efficacy in treating pain. He talked about its efficacy in easing opioid dependence and withdrawal, and even aiding to break some addiction patterns and cycles. And he said, again, it's not causality, it's correlation right now, but it could suggest that access to legal marijuana could save 10,000 lives a year. And I think Canada is in a great position to study this. We are in a little bit of a bind in the United States with what we're allowed to research as it relates to marijuana. NIDA, our National Institute of Drug Abuse, only funds studies that show harms of marijuana, no studies that show potential benefits. So I think Canada could potentially become a leader, and I would suggest funding some of this research at universities, at health centers, so it could add to kind of the global debate around this. And something that hasn't been done anywhere and is kind of an out there idea, but Canada has just authorized over 30 drug consumption rooms or supervised consumption spaces, which from a harm reduction perspective, I fully congratulate. I hope we follow suit soon. And it might be interesting to see what it would look like to offer marijuana to people who are using those services, and to see within the range of medications that are currently offered as opioid substitution therapy, where marijuana could fit within that. Okay, so now I am going to move on to talking about marijuana regulation as harm reduction for punitive policies, and I'm going to talk about criminal justice, education, investment of resources, and repairing the harms of the drug war. So to begin with criminal justice, I mean, for me, probably the most important effect of marijuana legalization in the United States is the thousands and thousands of people who are no longer being stopped, arrested, charged, convicted, and saddled with criminal records at great cost to their own lives and at also great cost to the state for marijuana use and possession. And in the United States, that plays out in a highly racialized, racist way where, Black communities and Latino communities are vastly disproportionately incarcerated and arrested for drug offenses and marijuana offenses, despite similar rates of use amongst all populations. So after legalization, we did see a plummet of arrests for marijuana possession of 99% in Washington, D.C., 96% in Oregon, and 93% in Alaska, and also similar drops in other states that legalized. And that is extremely significant and nothing to brush over. That said, disparities persist. Even after legalization. And so what we see, in Alaska, after legalization, absolute numbers drop. There's still disparities. But very concerning in DC has been a shift in enforcement of marijuana use and possession laws to public consumption. And that's where we see extreme racial disparities continuing. So you can see that post-legalization in the bottom right corner of DC. Of public consumption for marijuana. Something similar is happening also amongst youth, where before legalization, for example, in Oregon, adults were arrested at higher rates than youth. It's now swapped over post-legalization. And then in DC, similarly, arrests for public consumption has gone down, but not by a lot, not by enough for youth. And I did just put this slide in here because people are so worried about young people under a legalized, regulated system. Just to show in the states that have legalized, use amongst adolescents has remained relatively stable. So that is not something to be we should be concerned about rates of problematic use, most particularly, and use amongst youth, but it hasn't shown, the sky hasn't fallen in those states. But really, these lagging disparities, along race and age, are big areas of growth for the United States, and it is something that I would recommend Canada consider 3 policy options. The first being, fully ensure decriminalization of use and possession for young people. Young people won't have access to legal regulated marijuana in the new system, but they shouldn't be going to jail or arrested and saddled with criminal records for something that is illegally. If we don't think that adults should be going to jail for marijuana, neither should kids. I heard earlier this morning that fines are given out or tickets. That can also, fall more burdensomely on some communities than others. And I would recommend looking at California's law, which changed for people under 18, it from a criminal record to an infraction, where young people are requested to attend counseling programs, drug education, awareness programs, or community service, and they don't carry that criminal record with them then. So I would recommend that as number 1. Number 2, police reform and reforming police practices is tantamount in a regulated system, because regulation doesn't immediately change police practices, and as we've seen, there's still concerning practices in the United States. The ACLU released a report called The War on Marijuana in Black and White, and has a great section on recommendations for policing that include making marijuana offenses the lowest law enforcement priority. So even things like public consumption, just designated as a lower enforcement priority, racial bias trainings, methods to end racial profiling, increasing data collection and transparency, oversight of police department and practices, key in a regulated system to prevent some of the persisting disparities that we see. And third recommendation on this, we heard this morning from someone ask a question about legal consumption spaces. If we are going to have a regulated system where adults have legal access to buy marijuana, they're going to need some place to consume it. And some people, it's not viable to do so in their homes, whether it's because of their familial context, or more importantly, if you live in public housing, at least in the United States, you are not allowed to, you can be evicted for drug consumption, and that is not okay. So I would encourage Canada to look at, I think someone was saying there's a policy brief that I'm going to shout out, and about consumption spaces, and also look to maybe models like cannabis consumption or social clubs in Barcelona and in the Basque Country, where people can go to legally consume. Okay, moving on to drug education. So as we know, prohibition just feeds misinformation around drugs, and really centers these kind of fear-mongering, myth-based campaigns like DARE and Just Say No that just don't work. It's been proven they just don't work to reduce marijuana use, marijuana consumption. And so what regulation does provide us is with an opportunity to create honest, evidence-based campaigns that are focused on informing the individual and focused on reducing the harms of marijuana use in an honest way. So Colorado used some of its funding to its Department of Public Health and Environment, created this Good to Know campaign, which both educates people on the law itself, so what you can and can't do, can't consume in public spaces, can't give to people under 21, but also on harm reduction practices for consuming the substance. So go slow with edibles, don't mix. And this is a world of difference from what we're used to in the United States. And we haven't had enough time to evaluate any of these programs, but I will venture to say they are probably more effective than the fear-mongering of the past. And my colleagues just launched this Safety First Real Drug Education for high school students in a public school in New York, as mentioned earlier. So I think this is a good moment for Canada to engage in, you probably do engage in much more honest drug education than we have in the United States. But I would suggest continuing and using this as an opportunity to grow that. Okay. Moving on to marijuana regulation as a means to invest resources in social and public programs. I won't explain this, but essentially in the states that have legalized marijuana, the revenue from taxes have increased over what was expected. And what is wonderful about all of the 9 states in the US and DC is that they have directed a chunk of each of their proceeds from tax revenue into social and public programs. 5 minutes, okay. For example, California, I mean, all of them use some money to cover the administrative costs of regulating marijuana. And then California, for example, puts the rest into research, community reinvestment, youth treatment fund, environmental restoration, highway patrol, local government. Colorado, the first $40 million every year to school construction, public school fund, healthcare prevention and treatment. Washington, substance use treatment, education and prevention, marijuana-related research at the University of Washington and Washington State University, basic health plan trust accounts, community health centers. Oregon, similar. And Massachusetts and California really go furthest in terms of investing resources into the communities that have been most harmed by prohibition. And that is usually the communities that have been most impacted by criminalization. So one part of Massachusetts funding will go to restorative justice, jail diversion, workforce development, and mentoring for formerly incarcerated people, which is really incredible. And so before in a system under prohibition, most of our money just goes to law enforcement. Now we are actually able to use some of the tax revenue to designate towards social and public programs. And I'll finally move on to my last point, which is that good marijuana regulations should seek not only to reduce the harms of prohibition, but also to repair the harms of prohibition, and particularly for communities that have been most impacted by our prohibitionist policies. And I will suggest, 3 major areas of trying to repair the harms. One, record expungement and retroactivity, market equity, and reinvestment of resources. So on retroactivity, so reform should be retroactive, that goes without saying. And then in terms of expungement, we talked a little bit about that this morning. Really the best case would be automatic record expungement. In California, the bill does allow for record expungement, but it's fallen on different organizations. So these are some of my colleagues that were actually funded by Angelus Emeralds. I think that's a marijuana company, so the private sector doing some good here. And they host these free expungement clinics around California, which is, as Ethan said this morning, this is really where we do get most emotional around what marijuana regulation has been able to achieve for us, because these are people whose lives are being fundamentally altered by these policies. But in a better case scenario, the onus would be on the courts to do this, not necessarily just social organizations. Second, market equity. Kind of the new face we're seeing in a lot of the marijuana business stories is a white man in a suit with an MBA. And yeah, there is a lot of interest in the marijuana industry, but we can't forget who has predominantly been affected, and also who may be excluded from the new industry. So there are ways to introduce market equity, and that would be to lower barriers to entry to the new market. Things like making sure that a prior conviction or even a felony, like in California, can't be the sole basis for denying someone a license. Prioritizing small businesses. Also, they're trying to do that in California through licensing limits, so vast access to capital is not needed to enter the market. Or introducing equity programs. So Oakland introduced the first equity permit program where 50% of marijuana business permits go to equity applicants. Portland in Oregon is using some of its tax revenue to fund women and minority-owned businesses, and Massachusetts, its law stated that it must encourage full participation by people in the communities most impacted in the new system. So equity, market equity, and finally reinvestment of resources, which is something I touched on in California and Massachusetts, and highly suggest that the localities or the federal government in Canada does something similar where it does designate a portion of its funding to communities most harmed. In California, community-based nonprofits will get funding through marijuana tax revenue to work in their own communities, and help with things like substance use treatment, but also re-entry and a whole host of other social justice elements. So to conclude, these are some of the policy recommendations that I touched on throughout this presentation. I'm around later on today and tomorrow for any questions, but I will just end by saying that in a lot of parts of the world, it's no longer the question of whether marijuana is going to be regulated, but when and how. And I do think it is our responsibility as advocates, as politicians, as academics to try to ensure that it happens in the best way possible, that we use as many of the regulatory tools as we possibly can, that we push our governments to do it in a model way, but that we also prioritize marijuana regulation that focuses on social, racial, and economic justice and includes those that have been most harmed by prohibitionist policies. So thank you.